Hello, I am Dr. Hashitha from working in Shankara Cancer Hospital as a radiation oncologist. October is the month of breast cancer awareness, and as a part of it, we are here today to discuss about radiation therapy for breast. Radiation therapy is routinely given to breast cancer patients post their surgery, either after their lumpectomy or if they've removed the complete breast. So this is for a span of 3 to 4 weeks. It will be a daily procedure for every day about 5 to 10 minutes. So most people are very apprehensive about the side effects of radiation. Radiation in breast does not cause much side effects. It does not cause hair fall. It does not interfere with their immunity. So most women will be of the opinion if they can go to work or resume their work, and do they need to have any separate diet or any other lifestyle modifications. None of it is necessary. They can continue to resume their work, and they can also continue to do whatever normal activities they are doing. There is no need for any separate lifestyle modifications during the course of radiation therapy. And the other question that most women have is, I am getting treated for my left side breast cancer, so what about my heart? Will it cause any toxicities in the long run? So rest assured, we do planning well before this radiation treatment starts, and we make sure that the lung and heart doses are within our constraints and there is no long-term side effects for these patients. Sometimes we also employ certain higher end techniques where we ask patients to have deep inspiratory breath hold and treat them, so we can reduce their heart doses and thereby reducing their comorbidities. So radiation is perfectly safe and it does not have any long-term side effects for these kind of women.